Assalamu alaikum. I'm Shanzali and I'm going to discuss with you bone markings. Bone markings are projections and depressions found on bones. They help to identify location of other body structures, and below is the chart in which some bone markings are discussed. Now we are going to discuss some examples of bone markings. The first example is acetabulum. It is a cup-shaped, deep and smooth articular cavity in pelvis, also known as os coxae, especially in the hip joint that articulates with the head of femur. The second example of bone markings is glenoid cavity. Glenoid cavity is a large, smooth, and shallow articular cavity in scapula that articulates with the head of humerus. The third example of bone markings is trochlea, a pulley-like articular mass in distal part of humerus. The fourth example of bone markings is cochlea, an articular surface that is reciprocal to trochlea. The fifth example of bone markings is favai, a small depression which is non-articular in head of femur. The sixth example is facet, a small articular surface in radius that articulates with humerus. The seventh example is crest, a linear sharp ridge in the first image. The eighth example is line, a very faint ridge. The ninth example is foramen, a natural opening in bone, and the examples are the nutrient foramen of scapula and humerus. The second image shows the nutrient foramen of humerus. The 10th example is fossa, a large non-articular depression in bone, and the third image shows the fossas of scapula. The 11th example is process, a general term used for prominence. The first image shows the coracoid process of scapula. The 12th example is head, a rounded, smooth, strongly convex, articular projecting mass on the proximal end of a long bone. The second image shows the head of humerus. The 13th example is neck, a attachment between head and neck. The third image shows the neck of humerus. The 14th example is canal. If a foramen has a length or has a second opening in bone, that tunnel is known as canal. The 15th example is condyle, a smooth, large, convex articular mass on the distal end of bone. The first image shows the condyles of humerus. The 16th example is epicondyle, the rough enlargement part that is proximal to condyles. The first image in the PPT shows epicondyles along with condyles of humerus. The next example is sinus, a large air cavity within the bone. The 18th example is spine, a elongated, thin, pointed speck. The second image in the PPT shows the spine of a scapula. The 19th example is tuberosity, a large non-articular projection. The third image in the PPT shows the teres minor tuberosity of humerus where teres minor muscles are attached. The next example is tubercle, a small non-articular projection. The first image in the PPT shows the tubercle of humerus. The next example is trochanter. The tuberosities present on the bone femur are known as trochanter. The second image in the PPT shows the trochanter of femur. Thanks for watching.